Okay, once again, one shoe on, one shoe off. What we talk about today is how to do what we typically see in our patients, and from what I've seen online, just like you guys have, how to do a calf stretch. And I'm going to show you today the improper ways to do the calf stretch, because there's right and wrong ways to do every stretch. And there's right biomechanical ways, and there's ways that might help one area but could hurt an adjacent area. So let's maybe just give you a couple things here that you probably have seen. But of course, you got the pro stretch that's out there. People stand on this, shoe on, preferably, pretty painful with your shoe off, and they stretch back like this. Okay. Versus stretching over the edge of a step. Okay. Ball of your foot and dropping this way. Okay. Now let's talk about these for a second. This whole idea of just this stretch in and of itself is certainly a stretch that could be done for more of the advanced cases that we see. People that get over their plantar fasciitis or their heel pain or their Achilles pain, they can start to progress to a more advanced stretch. But most people will do this with the ball of their foot on the edge and drop down. And say, for example, they have concurrent foot issues, Morton's neuroma in the ball of their foot, or they're just sore because they have just not much fat pad in the ball of their foot, and they're imparting a lot of stress down through there. And because your heel can dip, well below the surface you're standing on, this can actually irritate the initial stages of a plantar fasciitis or a heel spur syndrome or an Achilles tendonitis sort of things. You have to be careful. And then people start doing this bouncing thing on here as well, which you have to stay away from. And the same things apply to the pro stretch. This whole idea of as soon as I put weight down through this, right, I'm putting pressure down through the ball of my foot. That little extra stretch that occurs there, which that can be good for some things, okay, but not for other things. That same concept, all right? And as you're doing this, some people tend to bounce or they tend to balance. And then they start doing this with the other side, which can cause issues on this side too if they have bilateral symptoms, bilateral plantar fasciitis, which we see a lot of, okay? And then, in the same vein, some people we've seen online and patients that come in and show us what they're doing at home, they ask them, show me how you're doing your calf stretch, and they go up to the wall and they put their foot, boom, right there. Okay, they kind of hug those toes up against the wall. I'm stretching all those metatarsal joints. They've got metatarsal pain or a neuroma, a nerve issue in the ball of the foot, not a good thing. And they're also imparting a heck of a lot of stress on that heel, right? Because they're pushing right down through it to stabilize it. Okay, so not a great stretch for all these other reasons. So if your heel hurts and you put that amount of pressure down, whether it be with your shoes on or your shoes off like this, that's going to hurt. Not be a good thing. Then they go to the typical up against the wall thing, okay, and have no concept of what position their foot's in or their body's in as they do it. So most of my patients will go up to the wall, they'll show me how they do this, and they'll do one of these things, okay? And I'm going to stretch it this way, and I also get in and start bending this way as well, okay? So as your foot's turned off to the side there, what are you stretching? Okay, it's not a symmetrical stretch. You're actually externally rotated, right? And if you're flat-footed, this is what people do. They'll be flat-footed and they'll be stretching like this. Now you tell me, does that look like that's a proper stretch for my Achilles, for my foot, for my calf? As you can tell, as I'm doing this, I'm slackening this side and I'm stretching the heck out of this side. And as a result of that, of course, a lot of stress can be placed on this nerve and your tendons that course right through your tarsal tunnel, right down through here. These are all things that you want to avoid, because in a lot of cases, plantar fasciitis, the cause of it could be a nerve entrapment through here. And all this stuff is just going to make it worse. Okay, so these are things you definitely want to avoid. So those are definitely the pitfalls of calf stretches. Okay, that's good.